Welcome back to Fox 51 Today. If you've got a problem with snoring or living with someone who does, there might be a way to fix that noisy problem.
We need it.
No, definitely. Dr. Ghuge with the Sleep Medicine Institute of Texas joins us this morning with some tips. Good morning.
Good morning, Rachel.
Now, you've been in this business for a long time. You've seen a lot of advancements, but you're saying that there's one new treatment or device, you could say, that's really helping people with their sleep and snoring.
Yes, snoring hides behind it a problem called sleep apnea. Mm-hmm. And sleep apnea can be dangerous to your health. It causes high blood pressure and many other problems. Traditionally, we have treated sleep apnea with a PAP device that helps you breathe better when you sleep, and it eliminates the snoring. But over the last several years, we've started to use an appliance, an oral appliance. We call it a mandibular advancement device. And it helps to stabilize the position of the jaw and does not allow it to fall back in your sleep. And so it helps reduce snoring and reduce apneas.
Oh, wow.
I know for many, including myself, could not tolerate the machine, at least maybe didn't work at it enough, the PAP machine, but trying this dental appliance or mandibular device, it seems to have helped. But I also know that, what are your thoughts then on follow-up tests with that? And then what do you think about that?
That's a great question. See, when you do any intervention in medicine, you want to assess the impact, the effect of that intervention. And there is no difference when it comes to mandibular advancement device or dental appliances. So typically when we customize an oral appliance, we do that in our office, and then we let the patient use it for several weeks, and then they come back and do a sleep test with it. And so we can identify if the apneas are completely controlled or not.
Well, now, what are the big differences between the CPAP and the mandibular device? Could you kind of explain that to us?
Surely. A CPAP is a machine, requires electrical power. It has a hose and a mask that goes with it. You have to carry all that with you. Mm-hmm. The oral appliance is something like this.
Oh, wow.
So it can fit in your purse. It can fit in your handbag. It does not need electrical power. It is customized to your teeth. You carry it with you when you go everywhere. And so many of my patients who travel a lot use mandibular appliances when they travel, and then they use their CPAPs at home. Sometimes they combine them and use them together. Sometimes they just use an oral appliance.
I know something I've been concerned about as a user of one of the appliances is that over time it might get a little looser. It might loosen, and they may need to be remade perhaps.
Yes, the appliance that we customize can be recustomized up to 100 times.
Ooh,
oh,
awesome.
wow.
So it can be readjusted if you get a cap put on a tooth or you lost a tooth or something. We can definitely recustomize that appliance. And then you can always get a spare appliance if you want one.
Yeah. Well, that's always useful. Like Robert, you were saying you have sleep apnea. I know my dad has a really bad problem with snoring. What are some main signs and symptoms that we really need to watch out for to see if we have apnea?
Snoring is by far the most common symptom of sleep apnea, but I have seen patients that have sleep apnea that do not even snore.
Wow.
So not feeling rested when you sleep, waking up feeling tired, getting headaches, blood pressure starts to go up, or if you're on blood pressure medicines, the blood pressure is not getting controlled with them, you're getting acid reflux, you're having problems with heart disease or stroke or congestive heart failure, falling asleep at the wheel, getting drowsy, can't focus in school, memory issues.
Wow.
And so on and on and on.
So a huge list. Well,
yes.
Thank you so much for this information. This is very, very useful. And if we want to find out more information about the Sleep Institute, we can go to sleeptyler.org. Am I correct?
Sleeptyler.com.
Oh, .com. All right.
Yes,
Well, thank you so much
absolutely.
for stopping by.
Thank you very much.